T-Bone and Heather in the morning on Star 98.3 and 97.7 The Bay.
We're going to jump in here a minute. 7 minutes after 8 o'clock, 8:07, because I've got Dr. Polsky on the line. Good morning, sir. How are you?
Good morning. I'm doing well. How about the two of you?
We're hanging in
okay.
there.
I'm doing okay.
He's got a stuffy nose and a scratchy throat, but that's
I think I'm going to live.
We can get you tested either in St. Mary's or Calvert.
Okay.
I don't think it's COVID.
I think I'm going to live.
There's
I think I'll be all right.
There's no fever, nothing like that. I think it's summer thing, allergy thing, but
I hearken back to one of our earlier conversations where you said would you normally go to the doctor for that? And my answer would be a resounding no.
Right.
So I think I'm going to write it out and see where it goes. Good morning, sir. Glad to have you along with us.
Before I let that go, if you're, and I don't need you to divulge your health history, but this would just be for anybody in general, if their underlying health history is pretty clean and they're below age 60 and there's no one else in their household that has significant health problems, as long as they're not around other people and they can keep themselves isolated for 10 to 14 days, and that's fine. If any of those apply to people, they really should get tested just to make sure.
All right.
Good to know.
Welcome to the show. Glad to have you along with us. Our phone lines, of course, are open for you. The big talking point this morning, obviously, is the news that there's a big jump in numbers.
Right.
Thankfully, our home front, Maryland, sees we're still continuing to trend down. Well, I shouldn't speak for you. I believe we're trending down, right?
So the state as a whole, the numbers have been coming down. I will say we crunch our numbers from Thursday through the following Wednesday. So we just got our numbers for this past week this morning. Our numbers in Calvert actually inched up a little bit, not dramatically, but there was a little bit of a bump up.
Okay.
And that could just be a random fluctuation of numbers, so I don't want to make too much of a relatively small subset. But it may be that we're starting to see a little bit of a shift in things.
I don't like that.
A shift? You think in the increase in numbers?
Well, and again, I don't want. I'll know more in a week or two. And I think what we in the public health sphere were interested in what was going to happen in the 2 to 3 weeks after restaurants and other businesses started to open, and then what happens in around July 4th. So I think next week we'll have a little better idea, and then over this next month is really going to be the critical time.
Where is the testing in Calvert County? Is testing increased? Has it? I mean, are people getting tested on a regular basis in Calvert County? And how many tests have been applied to people?
So testing is readily available, and it really can happen in one of two places. So most doctors' offices are now offering testing at their office. And for those people who either don't have a primary care physician or if their primary care providers are not offering testing in the office, we also have a drive-through testing site in Prince Frederick.
Okay, and how many tests have been given in Calvert County since this whole thing started?
Oh, I have to go back and take a look. So last week we had a bit over 500 tests. The couple weeks before, we were seeing over 700, but that was influenced by the mandatory testing was happening in nursing homes.
Oh, I gotcha. Okay.
So
okay.
At this point, and if you look way back when testing was really restricted, those numbers don't really apply to what we're able to do now. So I would say that the numbers we had this last week, we had about 525 tests done. That's a pretty good indicator of what's going on right now.
Now, the drive-through testing, walk me through that process. I mean, can you just be driving down the road and go, what the hey, let's get a test?
No.
Okay.
So, but it is open to anybody who wants to get tested, but there is a process that they need to go through. The reason we don't just have anybody drop in is that it's very, very important that there is proper follow-up. So if somebody has a positive test, we need to make sure that that person can be contacted properly, that they can get proper instructions. And so although there are, I think, 2 test sites in Maryland that are allowing no appointment, no doctor's order tests, every other site in the state is doing what we're doing, which is somebody needs to have a referral from a licensed healthcare provider. For people who don't have a primary care provider, and I think this goes also for St. Mary's and Charles County, that we can link people with one of several practices that are accepting new patients. That can happen same day, And what will happen is that for somebody that has a primary care provider, they don't need to be seen necessarily by their primary care provider, but they would at least call their office. Their physician or nurse practitioner can put an order into a computer system, which then links to our testing site. And once the order is in, then the person who wants to get tested will get either a text message or an email to select an appointment time, and then they just need to drive in, and we'll go ahead and test. The test results then automatically go back to their doctor or nurse practitioner, sometimes in 24 hours, but almost always within 48 hours.
I saw in the news this week that there was, I guess it was a steroid, some kind of medicine that was helping people on ventilators. Do you know anything about that?
Yes, dexamethasone has been around for a long time, 50, 60 years. It's a tried and true general anti-inflammatory steroid. Prednisone, if anybody's been on prednisone, it's like a first cousin of prednisone. The study has not been published yet, and there have been other studies looking at steroids that have not shown that degree of improvement or any improvement. So I'm a little hesitant to put too much into that one study. It certainly gives some hope. What has come out, although the study itself hasn't been published, but what the authors of the study or the people running the study have said is that they saw a significant improvement in people on ventilators. So this is not something that would be given to someone who, let's say they have a scratchy throat, sore throat, a little bit of a cough, and they get tested and they have COVID. What apparently this research is showing is that for people in those situations there is no benefit for them, but for people who have really severe illness, what they said their data shows is that it decreased deaths by 1/3, which is truly significant if the data holds. And I'm putting it that way because we've all seen some research that was trumpeted in the press, and then when the research actually was peer-reviewed and came out, turned out that it wasn't so hot. So hydroxychloroquine, there was something that I don't think we talked about on the radio, ACE inhibitors, that there was some research there, and those studies, after they went through peer review and scrutiny within the medical community, actually those studies were retracted because the data quality was so poor.
Mm-hmm. Huh. Well, speaking of things that we didn't talk about on the radio, is there anything that we didn't cover that you're looked at or you might have access to that you go, oh, this could be interesting?
Well, I think at the moment, and certainly in conjunction with everything the discussion that's going on about racial relationships in this country, that we continue to see data both on state level and national level that African American and to a little bit lesser degree, but still significant degree, Hispanic population has been adversely affected by the virus. And so we certainly would encourage everyone who is having symptoms, potentially could be infectious, to get tested, but a particular request to anyone who belongs to a minority population. And what we've seen at this point is that there are two factors. One is living conditions. So we all know that public schools tend to be somewhat segregated by the choices that people make as to where in counties they're going to live. So we see some schools that are the percentage of white students is greater than what we'd expect based on county percentages, and then other schools where minority percentages are much higher. And oftentimes in those areas of counties, housing is denser, and so it's more likely to see transmission of virus. That we know that people who belong to racial minorities oftentimes work in jobs where they have higher potential exposure rates.
So are we talking biology or are we talking sociology?
We're talking mostly sociology.
Okay, that makes sense. Yeah, that would make sense.
And then because for various reasons that people who belong to minority groups oftentimes have less access to health care. And sometimes it's because of lack of health insurance, but more often than not, it's because of the type of jobs that people have. They don't have sick leave. They can't take time off to go in.
Or they've got two jobs, right? They go right from one to another. Well, let me ask you this. How much does it cost to get tested?
Nothing.
It costs nothing in Calvert County. How about St. Mary's?
So I know there's people out there and say there's nothing free, and it always costs.
There's nothing free, doctor.
Yes. So that is true. But so when I say nothing, I mean it doesn't cost anything to that individual out of pocket.
Okay.
And so we have health insurance for a reason, and at least at this point, and I think for the foreseeable future. And there are other things that there are no co-pays, no deductibles. So when someone gets a mammogram, that's excluded from co-pays and deductibles. There are other sorts of tests that we've decided as a society we don't want there to be an additional financial barrier for people to have access to those tests.
Okay, so you show up to your primary care physician or you show up to the drive-through testing facility in Calvert County, you will not be given a bill and you will not get a bill in the mail.
Correct.
That's awesome. That's awesome. So maybe if people were like, well, I can't go because I don't have the money. Obviously, right now, a lot of people don't have extra cash to go. Now, that is something that is, I can't believe we haven't even talked about that yet. We've had you on for weeks and weeks. So it is absolutely no fee.
No out-of-pocket costs. And I know there have been quite a few people who have called us or called our local hospital to find out about testing. They did not have insurance, but they qualified for insurance either through the exchange or they might have been Medicaid eligible. And so not only were we able to enroll them for insurance so that because the test is free, but if someone should end up needing significant medical care, then there can be costs there. But it goes beyond that. So when we talk about underlying health conditions, regardless of race or ethnicity, everyone with diabetes, everyone with chronic high blood pressure, kidney problems, they are all at much greater risk for complications once they get infected. And so it's real, and we have talked about this in the past, it's really important expecting a second surge of virus in the fall, that people start getting their chronic health conditions under better control through the summer, so that if they should get infected in October, November, December, they're much less susceptible to end up in the ICU on ventilators or dying.
And I just saw a study real quickly about somebody, not a study, but some epidemiologist was talking about, listen, we're not going to get this thing under control until about 60 or 70% of the Earth's population has had it. Or has been, had the antibodies for it. I mean, 60 to 70%. How many people in the U.S.? Is it even 10%? 20%?
Hopkins has been doing their best to try to estimate, and it is just an estimation because we still don't have. Once we have reliable antibody tests, then we can get there. But what they're estimating right now is that most likely it's only about 5 to 6%.
Wow, that's it. The people that have been in contact with COVID.
Right, and just think about, and we've seen. I didn't look at the latest numbers, but I think we're somewhere around 115,000 deaths in the country, and in Maryland, getting close to 3,000 deaths. And still somewhere between 90 and 95% of the population are still susceptible to the virus.
Wow.
All right. Nothing but good news. Okay. Well, thank you, Dr. Polsky. It's always good to talk to you. Yeah, well, listen, we'll see where it shakes out, man.
All right. So everybody stay healthy. Just, again, be good neighbors. Be considerate to the people around you. And hopefully we'll have a reasonable summer. And it was good talking to you as always.
Yep.
As always, Doctor. Thank you so much. We appreciate your time.
Take care.
All right, bye-bye.
Bye-bye.
Dr. Polsky, he's the health director from the Calvert County Health Department, so we appreciate him calling in.
I don't. Maybe I should go get tested.
No.
I don't know.
Well, he says you should, but, I mean, you don't come in contact with anybody.
Well, no.
I mean, you're not out doing anything. You're
by
not out.
By and large, people have the good sense to stay away from me. And I think that's a valuable lesson.
It really is.
I don't know, man.
I don't know. You can go, but, then you got to go to your doctor.
Right.
And she
it's
has
just
to say,
who
yeah,
needs,
you can go. Maybe she has him at the office. Call today and find out. I know, right? I mean,
820. Phone lines are open for you.
I want the antibody test. Why can't we get a decent antibody test?
Well, why can't we get anything?
Because I think I've already had it, to be honest with you. I really do. I think if they had a proper antibody test, that 5-6% that Dr. Polsky was talking about, through the roof. Because most people are asymptomatic. They don't even show symptoms. They haven't even been tested. So that's what I'm thinking. I'm thinking if you had an antibody test and everybody started taking the antibody test, that number of people that were infected through the roof.
Well, listen, our phone lines are open for you. I don't think it's apocalyptic.
No, it's not apocalyptic.
I'm going to stay on the side that it's not apocalyptic. But
look at you, glass half full.
Well, sure. That's always my thing, Heather. I'm always optimistic.
You are not. You are the farthest thing from an optimist I can even think of.
821 phone lines are open for you if you want to give us a call this morning. 1-800-STAR-983, 1-800-782-7983. And if you're listening on 97.7 The Bay this morning, 301